Hello and welcome back to the Lynn Lowdown. I'm Danny Vittori, and today we will once again welcome the Community Outreach Manager for Brightview Health. Dan, thanks for joining us again.
Thank you so much. First and foremost, I just want to, I really appreciate you, giving me the floor like this. You all have been first class and have given us this opportunity. So really just want to, thank you very much on behalf of Brightview. We
definitely appreciate that. We always love to give floor to so many amazing organizations. And one of the reasons you wanted to come in around now is because holidays are coming up, Thanksgiving just happened, and that can be a very challenging time for people who struggle from addiction.
That's it, yeah. The holiday season can just bring out, added stress during this time of year for just so many different reasons. And for people who are, in recovery, certain things can, happen that could, possibly trigger that. So, with the added stress of the holidays, it's really important to make sure you have your support system and everything to, really get through it.
Mm-hmm. And what would be some tips that you would offer for things that people could do?
Sure. Well, there's various reasons as to why, you could have, you might have the added stress of the holidays, whether it's, the financial burden of, of the holiday season, whether it's, seeing family and friends is usually everybody has, maybe not everybody, but a lot of people have that one person just, rally up during the holiday season. And then the sense of like loneliness or loss, that could really add the stress of the holidays. And the ways around it is, for starters, it's to have those recovery supportive friends in your corner. Just whether it's a call or a text, make sure you have that support system with you throughout the holidays to make sure you have your routine and make sure you have those friends that are you'll be able to contact if you feel like you need to. Also, just be open about it with your family and friends. If they are your family and friends, they'll support you on it. They'll make the process easier for you throughout the holiday season, because, like I said, it can be difficult going to various parties and whatnot. So being open about it could be much easier in the long run. And then also, have an emergency plan in place. Have like a substance abuse counselor, at your disposal if possible. This industry, it's really 24 hours. My phone rings throughout, pretty much all day long, trying to help people get to the, any way I can. So, have that at your disposal. Call a substance abuse counselor if it's an emergency. They'll get you through whichever situation you're in. And then little things too, like if you're going to a party, if you have access to your own transportation, bring your own transportation. So, if you start to get uncomfortable or stressed out, when to leave, and bring your own drinks. Like if it's very easy to just, if you're in a social gathering, if you have a drink in your hand, someone won't be asking you, hey, do you need a drink? And you don't have to go through those questions and get into that. So just little things like that can, make it easier, throughout the stressful times of the holidays.
Mm-hmm. And I was curious, with your website and so many, they say having a plan and also having a routine are so vital. And why is that?
Because it allows you to, having a routine, it keeps your plan in place. If you wake, like, it's funny you asked that because my fiance and I recently just binge watching a show, and it's a reality show, and it's one of those, you're up till 3, you wake up whenever, and you can tell the people who are in recovery, like they're waking up, bright and early, 7 a.m., running around and sticking to the routine no matter where they are. It's important if you have that mindset of just having that routine, and it just you follow it pretty religiously. It'll get you through times like the holidays, and we just had Thanksgiving, and with Christmas coming up, it'll get you through times like that.
Mm-hmm. And even looking at statistics like last year, it was down a little bit. There were still 2,300 deaths from drug overdose, so it's still such a horrible and prominent problem.
So true. It's an epidemic that isn't going anywhere anytime soon. So yeah, it's one of those things that it's you need to if you need to educate yourself on things like Narcan and just be present for stuff anything like that. If you have someone close to you, just be supportive, because like I said, it's not going anywhere. So it's and although it's good that it's going down, but that number is still far too high.
Still far too big. And for Brightview specifically, what resources do you offer during the holidays, but also in general, to people? Yeah,
so I mean, our resources. I mean, we have 12 centers throughout the state, and you can make we have a 24-hour service line where you can call to speak to someone. But yeah, no, we're here throughout in each and every, as many communities as we can get to throughout the state. And no, we just want to, we offer, we feel really unique services to people going through addiction. And we'll be there, like I said, like throughout the holidays. If you need someone to call, like we're almost nice to a fault. Like we work too hard on helping everybody. So it's if you ever we're just always around to be able to help you.
And a vital thing I remember from our last interviews you said was time, responding to people quickly, making sure they don't have to wait weeks on end, because that can be so detrimental to them.
So it's such that time when a person decides that they want to fight their addiction. It's such a pivotal time when they decide that. And I remember we discussed last time, and it was we were saying that that person if they decide they want to make a change, and it's a month, however long it takes to get an appointment, a lot of things can happen in between that time that would make them maybe not go down that path. With with Brightview, we want to make sure we get you in as soon as possible. So if you call us and to schedule an appointment, we will get you in within 24 to 48 hours. We also take walk-ins up until 3 p.m. each day as well, because because it's important to really if they want to tackle their addiction, it's important that we're there for them whenever they decide to do so.
So we're talking a lot about the holiday season, but it's also important not just to have a plan for that, but then also beyond them too. It's not like it just stops after Christmas or Hanukkah or any of these.
That's so true. And although addiction is really tailored to be unique and a unique situation for each and every person, with us and with our outpatient program, you can really stretch it out for as long as you need to. But so just the holiday season is stressful enough, but life goes on after that. So with a program like ours, we could have patients throughout the entirety of their lives. You know what I mean? However long it takes to get them better. So whether it's the holiday season or just a regular Tuesday or Wednesday, addiction, like I said, it's not going anywhere, and we'll be there as much as we can to provide help for you.
One very specific point that I saw when I was reading that I think is interesting is when you're making your plan, when you're figuring out what to do, is saying it's acceptable to say no to something, which can be incredibly difficult just in general. I know I'm very bad at saying no, but why is it so vital to make that point?
In regards to who, us or the patient?
No, sorry, in terms of if you had a patient and they were invited to a party, let's say, or something, and something that maybe they're not very comfortable with, but they struggle to say no to it. And you say that's vital that they can do that. Yeah,
it's that's where having a support system comes into place. Like, hey, I just got invited to a party. I'm probably not the best idea if I should go. Having that support system for someone to be able to tell you, be in your ear and giving you the right advice, it makes it that much easier to say no. And everybody's, you've probably been in that situation where should I or shouldn't I? Having the right people in your corner can make that really, that much easier. Being able to say no is, can, in the long run, obviously help you in many situations.
And, so looking forward, I said, to the future for Brightview, you're coming into a brand new year. So what are you thinking about for this new year, these next?
Yeah, so it's funny. When I remember when I met with you last time, and also when I kind of began, my path at Brightview, it's just Brightview. And like I was saying earlier, everybody's addiction is really unique to their own. There's a lot of times when, patients come in and, after speaking with a physician, it may be determined that their best source of, help is, through inpatient or some sort of detox. So it's not only are we, continuing to grow as a program in Lynn, we're, obviously, helping more and more patients each day. We want to be able to, spread out our services and, build relationships with more partners to help our patients if we can't help them.
Yes.
You know what I mean? At the end of the day, the most important part is making sure the patient gets better. And if it's through, an inpatient program, some sort of, it doesn't matter. At the end of the day, it's getting them better. So at Brightview, we just want to continue to help our community that we're in with patients coming in. And we're also, we'll continue to grow our services and grow as a program as we go. But also we want to be able to help our patient in every way possible and continue to build relationships with various programs throughout the community to do so.
Mm-hmm. You definitely said do so coming on here and really making sure that you're visible in the community. And I have to wrap up in a moment, but was there anything that I hadn't touched on that you wanted to mention?
No, it's just that, obviously kind of the topic of discussion was the holiday season. So, if anybody's, out there and, they feel like, they may be struggling with, the stress of the holiday season, and you're suffering from addiction, if us at Brightview, we're here to help in any way we can. Whether it's just you come in, if we're very helpful, and we want to make sure that we can be there in any way we can. So if you ever, we're right on Munroe Street, and like I said, we're here to help.
So I want to thank you again for coming on to share all of the amazing resources that you have.
Thank you for having me. I really appreciate it.
Great.
And have a great holiday.
You too. And once again, I'm Danny Vittori. This has been the Lynn Lowdown, and we'll see you next week with more guests.